Hi, I'm Dr. Jennifer Cushing, clinical audiologist and owner of Live Better Hearing. Today I'm going to talk to you about a comprehensive hearing exam and a hearing aid consultation. Typically we schedule these appointments for about 90 minutes so that we can spend enough time with you to understand your hearing difficulties and then how to treat those difficulties that you're having. What we'll do when we do your hearing exam is we first check your ears. Always check your ears to make sure it's just not wax. If it is wax, then we're going to clean the ears and make sure that there's a nice clean environment before we do the hearing test. Then, when we start the hearing test, we're going to start out with a middle ear test to make sure that the eardrum is moving properly and that there's no complications within the middle ear. Then we're going to provide you with a test of the cochlea. This is a test to determine if the inner ear is responding to the sounds appropriately. After that, we go into the traditional test that most people will recognize, and that's the test where you raise your hand whenever you hear a beeping sound. Those sounds are going to be presented from the low pitches all the way up to the high pitched sounds, so we can determine what areas of difficulty you're having. After the tone test, we're going to be testing you with some speech words to look at the clarity of what you're hearing. This is really important because a lot of individuals will say that they can hear, but they can't understand what other people are saying. So during the clarity testing, we're going to provide you with a score afterwards to determine how many words you had correct. Also after that, we're going to provide you with a test that is in background noise, because that's the real world. No one ever listens in a quiet environment all day long. So the test with the background noise is going to be a woman talking, and you're going to repeat what she's saying in this noisy environment. And that will give us an understanding of how you're doing in the real world. Once your test is over, we're going to start the consultation. This is where we analyze the results that were just obtained and we review them with you. We're going to look at the hearing test and all the collective data to see if you're a candidate for hearing aids. Most individuals make a hearing test appointment because they're having some level of difficulty. So this portion of the test is important to determine if you're a candidate for hearing aids or if it's something that we need to refer you to see another professional for. The next step would be to try on the hearing aids. This is what we call the functional hearing test, and this is how we determine whether or not hearing aids are really appropriate for you and if you think that they're going to benefit you in your world. So we hope to see you in the office soon. Give us a call today. Visit our website, www.livebetterhearing.com.